Good afternoon, everybody. I hope that everybody is enjoying Bali and everybody had a good lunch. It is my great privilege to be sharing with you today our journey of ESG, a journey that started with a commitment and a lot of questions. What is ESG? Why should we champion it? How do we measure it? How do we know that it's good enough? And should we get accredited? So we had a lot of questions that we wanted to answer with ESG on our journey. But before that, a few things about Siloam itself. Oh, I guess I used this. Siloam is one of the largest healthcare providers in Indonesia. We have a vision to provide godly compassion through reach, scale, and international quality, and that's why it's led us to become the first of many things, such as we are the first accredited hospital in Indonesia for JCI, and we have a lot of other firsts. We have the privilege of serving the Indonesian community in over 39 cities with 41 hospitals and 60 clinics. We see about 4 million patients every year, and therefore, against this backdrop, ESG becomes even more important. So what is ESG? Simply put, we see ESG as doing right for everyone we affect: patients, families, staff, communities, and the world. And the larger your impact is, the more important ESG becomes. Now, why do we do ESG? We have a value, one of our values at Siloam is stewardship. It is the acknowledgement that everything under our care is temporary. And while we have it under our care, we have to make sure that we exercise good stewardship and we are responsible with what we have under our care. So, number one, why champion ESG? Number one is because it is the right thing to do. Hospitals are large social institutions. We create huge impact to the people around us and to the communities around us. And so we have to be very mindful of our impact, both positive and negative, on everyone around us, because we can be well-meaning and yet cause harm, as we know. And so ESG is a way to make sure that we have a increasingly positive impact on everybody we impact. Number two, the good news is that we hospitals have been doing ESG before ESG became a thing. The very intent of the hospital is to restore well-being to our patients. The very goal of the hospital is to better the lives of others. So typically, hospitals will score very well on the social part of environmental, social, and governance. And so hospitals have a lot of social goodwill. Now, unfortunately, the bad news is that we also generate a lot of carbon footprint. Let me get all these here. We generate a lot of a huge carbon footprint. We use a lot of energy. We use a lot of water. We generate a lot of waste. There's a lot of single-use products that we use. And so also there's a huge challenge with a lot of old hospital buildings. They're not very efficient with energy and the use of water and so forth. We have a lot of large equipment, and as we grow our footprint of large equipment, then we grow the use of energy even more. And so that I am glad that many equipment partners that we have at Siloam, such as Philips and other companies as well, Siemens as well, are spearheading sustainability and at the forefront of sustainability initiatives. This is really very nice for us to have like-minded partners. Number four, why champion ESG? Because it is becoming a must-have. It's a must-have to have an accounting department. It's a must-have to have a marketing department. Well, it's becoming a must-have for us to do and have an ESG team as well. If you are a publicly listed company in Indonesia, then it is a requirement. If you are investor-backed, then it is increasingly becoming an environment. And if you are JCI accredited, you will see that it is going to be a requirement as well. So this is our journey. So our journey, like everything else, like a lot of other things, ESG is a journey that we started with a commitment, and sometimes not because of ESG. So for example, we didn't start with certification. We didn't start with an award. No. Some of our initiatives with ESG started as cost-saving initiatives. How can we save more electricity? How can we save on our electricity bill? And some of our initiatives started as that. Our clinics in the interior of Papua, serving very remote communities, started simply for the love of the people of Indonesia who are unreached. And that's how it started. It wasn't an ESG initiative. But after years of trying to be more responsible in what we do and trying to do the right thing for the people that we impact, we started looking for ways to measure and benchmark. Because we know that whatever we can measure, whatever we can benchmark, then we're also able to improve. So we started talking about how are we able to measure and benchmark. And therefore, in around 2019, we engaged a third-party TEAL to do an energy assessment for us. We started engaging turnkey platform for us also to benchmark. We started getting assessed by EcoVadis, and so that we can benchmark ourselves to other hospitals and other industries as well to drive improvement. In 2019, we came up with our first sustainability report. 2023, we signed a sustainability pledge. So you get the idea. So you start somewhere and you continue to try to improve it, like you would also improve work on quality, and you would work on access and a lot of other things. So this is, in a nutshell, our journey, which has brought us to our sustainability framework that we have at Siloam, which is a 4-pillar strategy. The first one is caring for our patients, caring for our environment, caring for our communities, and caring for our people. So it's a 4-pillar framework with focus areas in each of the pillars based on materiality topics. Now, materiality topics are topics based on a survey that we conducted with our stakeholders to understand what are the topics in ESG that matter to our stakeholders. We came up with our materiality topics, and we put our materiality topics in our 4 pillars. Each of our pillars and each of our topics have measurements and have targets and have baselines so that we can see how we are progressing. The ESG sustainability framework is important for Siloam because it does a few things. One, it is a way for us to align the organization and tell our organization and also our partners what we're trying to do. Number 2, it helps us to set priorities. Number 3, it helps us to measure progress. Now, I'm going to go into some of the things that we've done over the years. So our first pillar is caring for the environment. We have done a lot of things over the years, and there is a lot of things that you can do to also reduce your carbon footprint that is created from the hospital operations that you lead. We have done a ton of things. We have optimized our chillers, we have retrofitted our AC, we have moved from diesel to gas and then trying to move to solar. We have harvested heat from our outdoor AC in order for us to warm our water. And this is just in the area of energy. In the area of water use, we have also done an initiative where we've taken reject water from our RO filtering process for flushing toilets, for watering plants, and this has helped us save around 7,000 cubic meters of water every year. Through our digitalization process, we also now use 60% less paper per outpatient visit than we did 5 years ago. We've recently rolled out a no plastic bags at pharmacy, right? Unless they're coming away with a lot of meds, we say no plastic bags, and most people, most of our patients understand. The move to digital radiology has also allowed us to eliminate film, eliminate CDs, and this is all eliminating waste. Now, the waste that we actually still generate, we try to see what we can recycle. And we found that we can recycle a lot of things. We can recycle a lot of a lot of jugs from the hemodialysis liquids, from the IV liquids, and we sell these things to factories, and we also get a little bit of compensation for that, so we can fund the process. So there are a lot of small things that you can do to get started. Now, the next step for us is to do a whole energy assessment that we're going to be doing this year in quantifying scope 1, scope 2, scope 3 carbon footprint and be able to reduce it one by one. But this is one area where we've done a lot of little initiatives, and we've been able to move the needle based on the initiatives that we have done. We have another example of another ESG initiative that we've done, an initiative that we have done, not an ESG initiative, an initiative that we have done that is now categorized under ESG, which is our Papua clinics. In this project, we have come into 10 villages with schools and clinics. 10 villages in the remote area of Papua, which is the last frontier in Indonesia, and it really is the last frontier in the world. These are villages that are not connected by road, and some of these villages have only made first contact with the outside world in the last 50 to 70 years. It is the first generation to experience modern healthcare, it's the first generation to experience any form of education, and we are here running basic hygiene programs, vaccination programs, stunting, and education programs for the community, and we have seen a huge drop in infant and child mortality, which has led to our schools becoming overcrowded. So we know that we are very successful in our Papua clinics. So this is something else that we have done over the years. We've been doing this for 10 years, and now the students who were first enrolled in our schools are now in the city. We're preparing them for university. So it is very exciting. They've gone from the Stone Age, now preparing for themselves for university. Another one that I'd like to highlight, one of the ESG initiatives, is on our scholarships for doctors and nurses. All of us around the world face a shortage of doctors and nurses, and it is important that we have a pipeline to make our operations sustainable. One of the areas where we've really invested in is nursing. There are a lot of bright young minds in Indonesia who would do very well if they were given an opportunity for education, and we have been giving them an opportunity by giving them a scholarship for a nursing program. We bring them to Jakarta, where they are then trained under Pelita Harapan University in a 4-year program with a scholarship from Siloam, and then 99% end up coming into Siloam and becoming that pipeline for nurses. And so as a result, we have a steady pipeline, and we graduate about 500 nurses every year, and this year we are taking in 550 students from the inner areas from Indonesia to become our pipeline. And so by doing so, it provides an opportunity for a lot of young minds to have a university education, but it is also a way for us to create a sustainable pipeline amidst healthcare shortage nationally and globally as well. Something that we've launched within the last 18 months is a program that we call Selangkah. Selangkah is short for Semangat Lawan Kanker, which means we are going against cancer together. And in this program, we're utilizing excess capacity of our equipment to screen women for breast malignancies. Our target is 50,000 in 2 years, and we are about half of that target. We go into remote communities, we go into women correctional facilities, anywhere where we can find people who don't usually get screened for breast cancer, then we would try to screen them, and we are in our 2nd year. So this is something unique that we've done, but not unique in the world. We have a lot that we do in the area of patients. We collect a lot of patient safety measures. Sorry, let me just get everything on the... There we go. We collect a lot of patient safety measures, but we also want to make sure that while we are delivering safe care, and I know a lot of you will also be collecting a lot of indicators as well, we want to deliver compassionate care. Now, how do we measure compassionate care? How do we measure how patients feel when they leave our facilities and they feel like we have made a betterment in their life? So what we do is we use Net Promoter Score, which is a score that we are able to benchmark to institutions around the world. It is collected digitally, analyzed monthly, and we have a system to channel feedback to departments and monitor resolutions, and also initiatives every year for us to be able to improve our Net Promoter Score. We also do a lot for people. We have a very diverse team. I am proud to say that we are 58% female, and this also extends into the upper management as well. A lot of my team is sitting up front here, hospital CEOs and directors, and also directors at the group level and supporting functions. You can see there's an overwhelming representation of women, and we are very proud of that. We run a lot of surveys, and we make sure that we have the right culture to support our staff with the right environment, and also the work culture to as a nurturing ground for patient safety as well. We do a culture of safety survey every year or every other year to make sure that we build the right attitudes within our organization. So I'd like to get to a few key takeaways. I think that oftentimes ESG can be very foreign, and whatever is foreign can also be very intimidating. But it is a topic and it is a theme that gets brought up over and over again. It is something that we should be doing. So where do hospitals have to start? Well, again, remember, hospitals have been doing ESG before ESG became a thing. It's just that now we have to be a little bit more structured. We have to make sure that we are able to quantify the impact that we have, positive and negative, and on all the people we have around us. So hospitals should focus on ESG, and ESG is beneficial for hospitals. It is very difficult to start, but my suggestion would be to identify a few key priority areas where you feel like your organization can bring measure. It is important to be able, can bring change. It is important that you are able to measure and determine where you are and where you want to be. And it is also good for you to align your sustainability goals with where the organization is headed. It's not helpful to have your own organizational goals and measures and then have a whole different set of direction and measures for sustainability. So the best is if these two areas are integrated. When you feel like it is the right time, it is good to be able to benchmark. And so we are super happy that actually JCI is coming out with sustainability measures as well. That has just been released, and I'm sure Andrew will talk more about this, but that allows us to be able to compare ourselves to other hospitals and or other organizations and see where we should be. One of the challenges that we have had in trying to progress in our ESG journey is to see where we should be, because there's not a lot of data published in ESG specifically for hospitals. And therefore, having it as a JCI standard, I told Andrew last night, would be super helpful for us in this journey. And last but not least, ESG needs to be championed by the organization leadership. At the end of the day, like a lot of other things, it is about leadership. But once we are able to cascade this down to our whole organization, it can be and it will be very rewarding. These are some of the key takeaways from our journey that I'd like to share with you this afternoon. And I wish you all the best in your ESG journey. And I'm sure we'll see a lot of wonderful work coming from all of the hospitals in the coming years. Thank you.
Hello, everyone. Thank you, Dr. Singh. My name is Andrew Rosen. I'm the Vice President of Joint Commission International. I want to start by asking you a question. What do all of these things up here have in common? Okay, you've got some ideas? Good, I'll come back to it in a minute. Today, want to answer just two questions. Firstly, why is Joint Commission International focusing on sustainability? And what does that mean for healthcare providers? And if you're not sure who JCI is, we can talk about that too. In fact, let's start there very quickly. I tend not to like to start with who we are, but I want to make sure everyone has context given these two questions. Now, if you don't know us, we're a not-for-profit healthcare improvement organization. We've been doing this for more than 70 years. We have over 23,000 accredited and certified healthcare organizations and programs across 70 countries, more than 70 countries. In fact, we're working right now with a number of wonderful Indonesian organizations and along with hundreds of others across Asia. So we're the biggest, the most experienced healthcare accreditor. But as you'll see today, I hope, and in the coming months, we're always looking for more ways to innovate, to improve, and to be more helpful. So why are we here today? In July, we published the 8th edition of our Hospital Standards for Quality and Patient Safety. And it was a top-to-bottom revision, primarily to simplify, but without watering it down. We took out many things that were no longer relevant or that were duplicative, for which the evidence has changed. So we tried to make things simpler. But we also added a few things. Healthcare evolves quickly, so we added guidance on cybersecurity, on EMR, and other technological advances. But most notable, and why we're here today, which is new and different for us, is a chapter on sustainability. So sustainability in a quality and safety standards manual, why? Let's go back to our pictures. What do these all have in common? Any thoughts? Now, you're too far away for me to get responses, but let me tell you what we have here. These represent a selection of important milestones in patient safety and quality across the past 200 years. But what I want to emphasize here is that historically, these were all moments when healthcare providers, some of whom were ridiculed at the time, realized that the care that they were providing patients was also causing harm. So we care for patients, but if we're not washing our hands, we could be harming them, or ourselves, or our colleagues, or others. We could create a pandemic. X-rays, right, radically involved our diagnostic ability, but radiation exposure causes harm, both to patients, to their unborn children, and to radiographers. Misuse and mismanagement of antibiotics is not just about the patient in front of you, it's about potentially creating a category of superbugs that hurt everyone. And in each of these cases, well-meaning professionals trying to help and caring for patients also create harm, sometimes directly to the patient, sometimes to themselves or their colleagues, and sometimes, and this is what's most relevant for us today, to the wider community. And now we have another to add to that list. We're increasingly aware there's increasing evidence that the operations of healthcare providers, your operations, caring for your community, can also adversely affect the health of that community and many other communities too. Now, you've heard already about some of the potential health effects of climate change. I could give dozens and dozens of examples, but here's one particularly striking one: heat-related deaths. So in this case, from The Lancet, heat-related deaths of people over 65 increased by 85% across the last 20 years, and projected to rise almost 4 times that in the next 25 years. But we're also talking about pollution effects, food insecurity effects, new pathogens, increases in mosquito and other vector-borne diseases, and also increasingly important is that these exacerbate inequity because they disproportionately affect those with lower incomes and in lower income countries. So in recent years, for example, it's estimated that pollution, just pollution, has killed more than war, more than terrorism, more than HIV/AIDS, more than tuberculosis, and more than malaria combined. Right? And 90% of those affected live in low-income countries. Here's some other examples of the various effects that the climate change can have. But the issue today is that hospitals and healthcare providers, as you've already heard and will be a big theme of all of our presentations today, are big contributors to pollution and climate change. And you've seen the headlines. Healthcare is responsible for 4.4% of global carbon emissions. If healthcare were a country, it would be the world's 5th largest emitter. And in US healthcare, for example, it's closer to 10% of national emissions. In England, Australia, Canada, it's between 5 and 7%. And hospitals, if you're a hospital, accounts for over 1/3 of healthcare admissions. But for me, a study in health affairs tells the story best. And I put the quote up here on the slide here. Researchers estimated that health damages, in this case from US healthcare pollution, in the latest year studied, were on the same order of magnitude as deaths from preventable medical errors. Think about that. And this is the first reason why the Joint Commission considers sustainability not just an ESG issue, but a patient safety issue. Healthcare operations, caring for people, harms patients, harms caregivers and communities by affecting the environment. The second reason is a little bit different. I don't think I need to tell anyone here in a nation of islands like Indonesia that weather seems to have become more extreme. An interesting study came out just at the end of last year from the Cross Dependency Initiative. They analyzed over 200,000 hospitals all around the world under different climate change scenarios. And they looked at what happened or what would happen with flooding, shrinking coastlines, wind, fire, cyclones. And their main conclusion was that by the end of the century, at current course and speed, 1 in 12 hospitals worldwide will be at high risk of total or partial shutdown from extreme weather events. Now, if these hospitals were residential or commercial buildings, they would essentially be uninsurable. Now, Indonesia, the number of high-risk hospitals in that projection would be projected to be 1 in 5. Now, I know 2100, or I don't know what we're going to call it, 2100, seems a long way off. They looked back too, and they found that between 1990 and 2020, so the last 30 years or so, there's been a 41% increase globally in risk of damage to hospitals by extreme weather events, and a 61% increase in Southeast Asia. And even worse, these risks much, much greater in lower and middle income countries. And Asia is particularly vulnerable. On the right here is a list of the countries with the most high-risk hospitals, and that's mostly a factor of size. India there with almost 70,000 hospitals, so it's going to have the most affected. But if you look at the percentage of hospitals that are projected to be affected, to be high risk, to be shut down by weather events, it's mostly Southeast Asia, right? As you can see here. And not on that list, so because they're lower down in terms of total numbers, Malaysia, Laos, Singapore, also similar 20% of hospitals at high risk. Now, in most places, what are these high risks? The issues are flooding right now. The next 20, 30 years, it's riverine flooding, surface water. In the future, it'll be coastal inundation. So whether or not your health system is contributing to carbon emissions and pollution, whether you have zero emissions, whether or not you consider your operations a patient safety issue, climate change is likely to affect you in other ways. Extreme weather will make your facilities and operations vulnerable. Right? They may make them inaccessible. You may have no power, you may have no food, you may have no clean water. Staff may not be able to get into work. And even if you're not damaged by the weather, are you ready for the surges in volumes that are going to happen when the community is hit by the weather, when they have no housing, or famine, or dengue, or heat stress? So the other patient safety issue here is to do with how prepared is your organization for climate change. Now, hospitals are already considered critical infrastructure, so you have a lot of defenses in place right now. The Joint Commission believes that hospitals have to move even further to improve their resilience, to be able to keep people safe during these rapid changes in volume due to the health effects of climate change and potential disasters and weather effects. So that's why Joint Commission sees it as imperative to start to consider sustainability, not just an ESG issue, but a patient safety issue. And why we work together with the Geneva Sustainability Center, which is part of the International Hospital Federation, to create standards and for it to be part of our general safety and quality standards for all hospitals and AMCs. Now, I will also note that because we think this is so important, that we've made these standards available to any organization to use, any accreditation organization. There's a nominal license fee, very, very small, but we think that that's important. We wanted to make sure that the world had access to them. Just a couple of notes, though, before I go on. Firstly, I don't want to suggest that we're the first to worry about this. Hundreds of healthcare providers, you've heard some already, around the world, and governments and vendors, you'll hear also after me, are doing fantastic work to improve the sustainability of their operations, to reduce energy, to reduce emissions, and we celebrate that work. And second, although I know that tackling sustainability can feel like an overwhelming idea, that it's so gigantic, that this is nothing to be scared of. These initial basic standards that we're putting in place are designed to help all organizations, especially those who are just beginning, to have a starting point. As you'll see, most of the standards are simply about starting to set up structures to think about sustainability in this new light as a patient safety issue. We have some pathways for more advanced providers too, so if you've been doing a lot and you want to move ahead and you want to be recognized for that, we'll be working on that as well in a more voluntary way, and we'll announce that in a few weeks. But these are the areas where we want to work to get started. So to give you a sense for where we're focusing, it's these 5 areas: governance, employee engagement, use of resources, procurement, and infrastructure. And so what I'd like to do with the remaining time is just to give you a brief explanation of the 5 areas and a couple of examples. I won't go into too much detail. So the first standard, and this is a summary here, is really about making sure that hospitals have prioritized sustainability at the leadership level. It's a cultural issue. This means that the board or executive team are educated. It means having a plan. It means regular reporting. Many of you are already required to do this by national regulation. It also means making sure that there's someone responsible in your organization for sustainability, right? If you're a large organization, that could be someone's entire role as Chief Sustainability Officer. If you're a smaller organization or have fewer resources, it could be part of somebody's role. But so I'd advise somebody who's going to be taking this on, who's going to be the central point. The second standard is about making sure that your staff receive education and training, as well as regular communication. It also includes involving staff in generating and implementing ideas for improving sustainability, because they're the ones, once they're educated, who are at the front line and will be able to see opportunities. Number 3, as already stated, hospitals use a lot of energy, a lot of water, a lot of cleaning products, a lot of gases, and create a lot of waste. In fact, electricity use by the hospital and in the supply chain is the biggest contributor to healthcare emissions. So this standard is simply about starting to measure, to measure how much you're using, to create a plan and target for improvement in major areas, especially reducing fossil fuel use. So buying more renewable energy, reducing waste, using alternative cleaning products, reducing anesthetic gases. And we don't mandate a target at this point in time. Again, we're not looking here to be advanced, just to start incorporating sustainability into the fabric of daily work. Number 4, the vast majority of hospital emissions actually comes from the procurement and the supply chain, about 80%. Right? So that means creating procurement guidelines that prioritize more sustainable suppliers, pushing suppliers to become more sustainable. Hospitals are big purchasers, right? You can use your purchasing power to move the market in this direction. It also means looking at the supplies that you're using, single-use supplies, and how they could be reusable. It's about better inventory control, less waste. And finally, based on what we were talking about in terms of hospital preparation and resilience, right, in the face of climate change, dangers and pressures, it's about ensuring that you have a robust and up-to-date emergency and data plan, right? Doing good risk assessments, understanding how the climate is changing, what is going to be happening in your area, involving the community in these plans. So that's a very, very quick, a whirlwind tour. And what you see here are a basic set of standards that I think can start to form the framework for thinking about sustainability and resilience in the face of unsustainability. We've put this in our 8th edition. The 8th edition comes into play, it becomes into effect at the beginning of January. Understanding that sustainability is a new area for many organizations, and many organizations are worried about it, and I hope I've shown you today it's nothing to be worried about. We are going to be measuring progress in 2025 on sustainability and scoring it, but it won't count towards accreditation until 2026, right? So we're giving organizations a little more time to prepare for this change. But as I said, I hope you can see that it's not a very big change at this point in time. Again, fairly minimal. We don't have fixed targets. We just want organizations to start to move along the pathway to incorporate sustainability into patient safety. There is very little investment required, no technology, and we'll guide you to many of the tools and checklists and trainings that you can use that are complementary and already out there and exist in the world, freely available. The next step after this, as I've said, are not new standards, but in raising the bar within each of these standards to hit certain benchmarks. That's something that we're working on. It'll be voluntary. More to come on that in just a few weeks. So to wrap up today, I hope that I've started to make the case for why the Joint Commission is and why we think you should be considering sustainability and resilience in the face of unsustainability, a patient safety issue, and why the coming initial standards are nothing to fear, and they give a great framework for organizations who are wondering, where do I start? How do I start with this? If you want more detail or you're already advanced and looking for recognition or a way to improve further, please come and speak to me, John or Nick, over at the desk in the exhibition chamber. Anyway, so thank you very much for your time.
Good afternoon, everybody, and thank you for the opportunity to visit the beautiful island of Bali in Indonesia and to speak at HMA about the topic of sustainability. Do no harm. That's how my colleague, predecessor on the panel, Andrew, reminded us of the goal of healthcare. At the same time, I would like to bring you one step further and to talk about how sustainability can be your core business imperative, also in a way a bit closing the loop to what Caroline, as a first panel speaker, mentioned, how the comprehensive approach, how it can be feasible, reasonable in its effort, and rewarding for your organization and your staff. And I will bring up 3 example case studies of the partnership with the hospitals that the Philips has done around the world. First, I would like to acknowledge the enormous pressure that right now there is in the healthcare. Of course, the patient demand is up, capacity planning is harder, there is a huge cost pressure, there's huge inflation, and this is next also to a staff shortage. And now regulators, patients, standards, requirements, governments put the pressure on the organization to expect sustainable results. So how we look at it in Philips, also together as partners, the sustainability is at the intersection between human health and the health of our planet, because the two ultimately come together. And what do we do often in such situation? Then we start running the small initiative somewhere on the side to get things going. And then what we see also around the world, that the small green teams are being set up with a lot of great energy, amazing talents, and they meet on Fridays or sometimes every quarter to start up their own initiative. But at the same time, that might lead also to frustration, disappointment, and also the feeling of not being heard. So instead of viewing sustainability as a standalone initiative, after decades of practicing this also internally as a company and also with our partners, we recommend that put sustainability as an integral part of your business objective and the key strategic lever of your organization. Now, why are we talking about it as Philips? Philips is the first health tech company that have achieved carbon neutral operations already in 2020s. We started our environmental agenda because of innovation, because we have innovation in heart and part of our DNA, and it was in 1970s when we started innovating for reduced environmental footprint. We started designing our product, and now we call it eco-designed, to reduce environmental resources needed for their manufacturing, production, delivery, and for their operations. Later on, a couple of decades later, we started the climate action agenda, and also we committed to the Paris Agreement in 2015 and signed up to 1.5 degree Celsius scenario. And also we joined the science-based initiative because we very much appreciate the scientific approach to sustainability, to act in line with your impact. And therefore, as a result, we became carbon neutral already 4 years ago, and also we power our operations 100% by renewable electricity. But also next to this, like Andrew mentioned, that one of the biggest parts of our carbon footprint is our supply chain. Our Philips operations is part of your supply chain. Our suppliers is ours, supply chain carbon footprint. And therefore we started working with our suppliers by incentivizing them with carrot and stick methods, also to commit to reducing carbon footprints. So by now we achieved about 46% of our suppliers signed up to carbon reduction together with us. We also make sure that we take care of our waste. In our operational sites, we send 0 waste to landfill, unless it's required by the local regulations. Here we also see that we participate in global ranking, ratings, EcoVadis assessment in order to be transparent, to avoid greenwashing, and we believe the standards creation, like also initiative that JCI pursuing together with others, very necessary for us to align on the metrics that is acceptable for all and is objective and is telling us about the benchmark and the impact. Now, coming back to sustainability in healthcare and in hospitals. What we recommend, based on our experience, is to approach sustainability as a program and start where you are. Some of us start from 0, so we need to get going, we need to make the first step. Some of us already reporting great results and would like to make step further. And what is this benchmark? What is this number 1 position? So first of all, the first step is scope, then assess, underpin with data, then make sure that you have the KPIs to report on and monitor your progress. And then the last part, personally my exciting part, is to drive sustainability, implement the projects. And the projects, they would come, some of them will come also with cost reduction and positive financial benefits. Some of them will come at cost. Some of them will require capital investments. They will have a really interesting ROI metrics, and a lot of this is positive. As our moderator, Dr. Kuljit, mentioned, it is a very rewarding program and appreciated by your investors, by your stakeholders, by your employees, and also has a very good financial metric that accounts for the climate impact as well. So here I would like to bring up 3 examples, 3 approaches how to perform sustainability, how to get started, depending on your level of ambition, on your level of maturity on this topic. First is a 360 sustainability assessment. When the organization is ready, willing to get going, right, we start from ground 0, and then it's an approach that we take to recommend you to take, basically to identify what are the key hotspots, what are the key issues of sustainability in your organization, then establish a champion on executive level, and also engage your staff to co-create sustainability agenda. The second type of work is what we see among the academic and medical centers is a collaboration for research. There's an enormous lack of data and scientific underpinning for sustainability in healthcare. And it's among the academic medical centers we see eagerness in this up-and-coming innovation and academic agenda to publicize more research that will bring great insights and value for everyone in the industry. And as the third example is sustainability strategic partnership, when sustainability is a part of the management agenda and you can join forces with your partner and to bring the joint commitments that you can reduce the carbon footprint and improve environmental performance for both together. So here's the first case study. It is in Gibraltar, which is UK overseas territory, south of Spain. And Gibraltar Health Authority has a very committed team, and they mentioned sustainability is an important topic for our society, for our community that we serve, but we don't know where to start. And what we did, because in any case, we have a running partnership with Gibraltar Health Authority, so we have done sustainability in our own practice, so therefore we brought the experts and we joined the forces and run such sustainability 360 assessment, where we applied the available data, where we performed the interviews, where we run the co-create workshop with the staff. We engaged about 40 people among the clinical and operational staff, and it's been an amazing project with a great engagement and communication and a great energy on this. And here you see example opportunity areas that I believe many of you will recognize that are actually relevant for most. For example, centralize and launch sustainable procurement and supply chain. electricity reduction, waste management, then operational and clinical efficiency, patient scheduling in CT and ultrasound, then to reduce consumable in ultrasound and mammography. But also next to this, you see key benefits, as I promised that I will share. Cost reduction, again cost reduction. Well, here's another interesting one, improving patient experience and clinical efficiency and improving staff satisfaction. So here let me quote Andrew Bonfantin, General Management of Gibraltar Health Authority. We recognize the crucial role the GHA must play in reducing carbon emissions across Gibraltar. While we already had some initiatives in place, we wanted to build on this and develop a green plan that would drive real change. So we're very happy about this project and very confident that together we can deliver impact that makes a lot of sense and make healthcare better for staff and for the community it serves. Now let me go to the next one. Let me bring you to the United States, in Tennessee State, and one of the leading university medical centers, Vanderbilt. In a discussion with Vanderbilt, we realized that we have a joint goal. It's actually to help decarbonize healthcare. And then we thought we should bring some of our strongest capabilities in sustainability and in clinical practices together, and then perform the scientific research that we will publicize for all, and we will share it with radiology industry. So here's an example of the research that we presented at the Radiology Society of North America last year, and the scientific publication is coming up in the coming months. As an example, it's the first of a kind comprehensive carbon footprint study of a typical radiology department. And I hope that it brings useful evidence to you that in a typical radiology department that operates 24/7 in the public hospital, that also has MR, CTs, X-rays, fluoroscopy, and ultrasound, here you could see the first two bars that actually makes the most of the carbon emissions, which is MR, by far the first, and also CT that comes the second. And it's not only energy consumption that drives the carbon emission, although energy is still the largest in radiology, but it's also usage of PACS, usage of data, how you manage the data, it's disposable supply, and it's also the hardware, because it's a lot of the materials that we use, and we should be able to reuse it or give it the chance for second life. And also such academic collaboration research could be part of your staff agenda for the development and for the research and studies. And it's something that you might find beneficial also for your academic reputation and credentials of your organization. Now the third one, last but not least, it's a strategic collaboration on sustainability between us, Philips, as an industry partner, and the large healthcare organization. In this case, it's Champalimau Foundation. It's a large, innovative Portuguese cancer clinical site and research site. And we came together a few years ago and concluded that we should do strategic partnership with joint commitments to lead on sustainability and reduce the carbon footprint in our joint scope by 50%. It's against our ambitions and convictions that we need to join forces across the whole value chain to decarbonize healthcare, but also we put the courage and commitment to call for a large number, a significant number that we will be very motivated to go forward together. And how we're doing that? So we are applying here the pillars that are both in our own control and also in the control of the Champalimau Foundation. First is eco-design of products. And some of you that know also, for example, radiology and medical equipment very well would know that about 80% of the carbon footprint of products are done as the design phase, how the products are designed, what they are designed for. Second pillar, no less important, efficient workflows, and also avoidable waste of resources, of time, of electricity consumption. Third pillar is end of use. When the equipment is end of use, How do you make sure that, for example, there's opportunity to prolong it or to manage it responsibly and also to close the loop with your supplier? And the fourth pillar, very important, is moving to a renewable energy sourcing that we do all together collectively. And in Philips, we have done it over the years, and we are absolute, adamant, convicted organization that we all will move into this right direction. As an example, we are 2 years down the road of this partnership, and on this chart you see that we already reduced 24% of carbon reduction, which is ahead of our expectations, and we are very happy to see this progress and hope that it inspires you and also makes it more viable, more feasible, and more practical to start to get on this journey. Let me quote Leonard Beleza, the president of the Champollion Foundation. Partnership with Philips will allow us to continue to ensure the best care for our patients, while at the same time helping to reduce the healthcare sector's environmental impact. I hope this quote again connects the dots why sustainability is at the core of hospital operations, whether it's patient safety or quality or overall organization strategy for the future. Now here, a brief slide again to emphasize that we believe the partnership to drive the adoption of sustainable practices is absolutely necessary, and also to expand access to healthcare. And the social impact as part of ESG is a very prominent, very important chapter, and we are very passionate about this, but let me leave it for another conference. So again, focusing on environmental topic today in my presentation, I would like to encourage us all to collaborate with our customers, with like-minded front-runners, also organizations like JCI and other NGOs and other independent parties that could keep us objective, transparent, and credible. And also governmental organizations, very important stakeholder and the decision maker that actually needs to drive all those changes on environmental agenda, and also other stakeholders like our own employees. Now, before closing, I was asked also to leave you with some very practical recommendations that you can already take to your organizations and could start implementing. And what we really recommend, so the first step, which is impactful, significant, and you can start comparing also your suppliers on the sustainability, is a sustainable procurement. Next time, when you think of the large procurement plan, think about including sustainability criteria. Sustainability criteria that will include all your suppliers, but that will stimulate and require them to measure up on the sustainability factors. For example, does a supplier has a greenhouse gas emission reduction plan? Second pillar, is there circularity, closing the loop on health technology solutions to reduce, make use waste cycle in our materials consumption? Third one, is there transparency about the product performance on the environment? The next one, digitalization and dematerialization, which is part of reducing carbon footprint. And the fifth one, social impact, which is at the core, of course, of the hospital's agenda. In summary, let me give you a few key takeaways. First of all, sustainability must be an integrated part of your long-term care strategy. Then you will succeed and you will be able to capture the rewards of this. Second, make it a program and drive it in a simple, measurable, and iterative way. Third, team up with partners to drive change at scale with transparency and science-based methods. And the first question, how to start today? For example, have a look at the sustainable procurement practices. With that, thank you very much for your time today.
So, what we heard just now, healthcare organization like our hospitals can actually collaborate with health technology partners to achieve sustainable healthcare solutions, such as one is implementing energy efficiency technologies, renewable energy resources, optimizing supply chain, you mentioned that just now, and also logistics to reduce emission and waste, developing sustainable product designs and packaging, and promoting circular economy principles such as reuse and recycling. And the other thing that you mentioned was research. And a lot of this you can only get if you do research. And I think this collaboration and working together actually will help. And many of us in the hospital line will find that as we go along, sustainability becomes a problem, both economically and also in terms of environment. So we'll open up the floor for questions, which right now I have. How do I use this? Do I have questions? Because I don't have anything on the. Please log in your questions if you have questions to the speakers, because we don't have questions yet, unless I have difficulty looking at it, but there's no questions yet. But maybe I will start off with my own questions, as you all can think of questions as we go along. Maybe we'll go to our first speaker. You did mention about your hospital, Siloam Hospital, and I think it seemed to be very successful. And out of your 41 hospitals, 3 are JCI accredited. That is what you mentioned just now. My question is, when you first started your ESG initiative, was there any increase in initial costs? Or was there any cost-based analysis that you had to do to your stakeholders, to your owners, to your investors before you started this initiative? Was there any cost that you had to actually prove yourself?
Thank you for the question. Yes, absolutely. I think that when, as business leaders, we want to run initiatives, but there's always going to be a responsibility for us to make sure that we justify it as well from a cost perspective, from an impact perspective, and we do run feasibility studies before we do some of these initiatives. Now, the good news is that a lot of the energy saving initiatives and the water saving initiatives that I shared on my slide actually do have an ROI. So if you optimize your chillers, then you will save on electricity. If you're able to recycle water, there is an initial cost of reconfiguring your pipes, but then forevermore, until you have to replace those pipes, there is a savings on water use. The recycling program that we run is cost neutral, but we do get proceeds from selling the plastic waste that is able to fund the process. So there are many ways for us to fund this, and oftentimes the ROI is 2 years, 3 years, which is very reasonable.
So are you able to prospectively show this when you are going into this era of proving this to the point? I mean, I'm just saying that many of us will go back to our owners, stakeholders, board members. Is there any prospective studies that you can show that there will be an ROI?
Yes, absolutely. So because we're a network of 41 hospitals, what we typically do is we do a desktop exercise on how much we think we're going to save. And there's a lot of technology that isn't new technology. And whenever we use consultants, whenever we then come to conferences and we talk to other people who have done it before, then we get this kind of data. Typically, we would put together a feasibility study. We would pilot it in one of our hospitals. We would measure the impact. And if that impact is validated, then we would roll it out to other hospitals.
All right, that's good. Okay, so we have one question for Caroline. In Siloam's ESG journey, how big was the initial investment? They read my mind. How did you navigate through this financial accreditation? I think you answered that just now. Maybe you can give one sentence in case you want to add on anything to what you said.
I think that I have to be careful in answering this, yeah, because I think that yes, a lot of the individual initiatives, especially when it comes to energy savings and waste reduction, there definitely is a business case to that. But at the end of the day, not all the initiatives and not the whole sustainability program cannot be driven mainly just because there is a cost savings. Because certainly there will be some infrastructure that we have to put in place in order for us to be able to measure, in order for us to be able to champion it. And I think that the main reason we should do it is not because there is a cost savings. The main reason that we should be doing it is because we only have one Earth and we have no other choice. And there are long-term implications for us not doing this. But all of the initiatives that I showed on my environmental slide had a business case to it and had a return to it. So I hope that gives a little bit more depth to the answer.
Second question is probably just related to you because you're the only person representing hospital beside me and you. Single-use items, does it really help in ESG, or you end up risking the patient with other areas of concern?
I think this is a question for Andrew to answer, because there are clear standards about using multiple use products and how to use reuse single patient products safely. And there are even standards and guidelines on how to reuse single-use devices safely. So can it be done safely? Yes, absolutely, it can be done safely. I cannot make a decision for your organizations on whether you reuse single-use devices, but I know that in a lot of developing countries, a lot of you and a lot of us may choose to do that. And so I think maybe this is a question for
Andrew, maybe you can
for
take
Andrew
that
to
question.
answer.
Yes, and I don't want to give a clinical opinion here because there's not one single answer to that question. For the Joint Commission, and one of the reasons we're partnering with the Geneva Sustainability Center, who has a lot more experience with sustainability, it's an early part of the journey here. And our hope is, as we work with more organizations who are going to be doing projects around issues such as reuse of single-use items, which is a very important area. We are going to learn more. We're going to be able to find out what the different clinical decisions in different organizations are based on their particular needs and on their particular environments and in their regulations within their own countries. And also in partnership with the people who do the supply of these instruments, etc. And we're going to be able to share, we hope, best practices and benchmarks around this so that we can all learn from each other as we go through the experiment, essentially, of working out using clinicians from our own organizations, using clinicians from our countries, using clinicians from around the world, and our own staff to be able to work out where the opportunities lie and where we can do this safely. And as we do this, there'll be more evidence built, there'll be more studies written, and we'll be able to point out and build the standards around what's possible and what's not possible. Some of that work's already been done, but I think we're still fairly early in that process, and we'll be able to find out more and share more on that as we go through this.
Right. So I think the other two questions kind of answer what exactly you have said. I have got a question for you. There are variation of efforts in ESG globally. And JCI, I believe that you are pretty global. Now, how do you set standards for different continents in the world? Because it will be different in Africa, it'll be different in Asia, it becomes more challenging in Asia, Oceania, then you have the United States, you've got South America, but the type and level of ESGs can differ from country to country and continent to continent. So do you follow a particular standard, or do you custom make standards for ESGs when you move around for different parts of the world?
Well, it depends. So for patient safety and quality, there are certain areas where certain things have to be the same everywhere around the world because there's a patient at risk, and certain things that are flexible depending on the environment. And that's something that our trained surveyors are responsible for interpreting at the time and trying to do that consistently around the world. We also have to take into account national and international and regional guidelines as well. But for ESG, I think that what I was trying to express in the presentation earlier was that we have deliberately made these initial standards flexible. Right? So we don't mandate an amount of water that needs to be saved. We mandate measuring water. You're already measuring water because you're paying for water, so you're measuring it. So we're not saying that you should reduce it to this many decaliters of water. We're saying, why not do a project that involves looking at how much water usage you have and try to reduce it by an amount that you choose, right? That's the beginning of starting a project for understanding and bringing patient safety into the organization. So these standards, at least in the 8th edition, are deliberately made flexible for organizations to choose the pathways that they would like to focus on to begin with based on their needs. And we recognize that there are organizations that are very early in the journey, maybe haven't even thought about sustainability, right? Don't have the resources. And there are organizations that have been doing this for many, many years and are already net neutral or even trying to, reduce for others in the environment as well. And so we'll be developing, as I said, a different set of standards or a more robust set of measures within those standards as well as benchmarking for those organizations. But for right now, that's how we approach doing something that, when we work in very, very different environments around the world. It's to create that level of what we look at everything. What is not negotiable around the world? What is the same? And then what can be flexible based on the environment? And for these, we've made them especially flexible to begin with.
So there is flexibility based on the region, based on the geographical needs, but as far as patient safety of the normal standards, that will not be compromised. For you, similar question, but in a different manner. In technology upfront, what you are in technology, in research, how do you manage the global challenges when you introduce some of your ESG approaches using technology? Because different parts of the world will have different type of challenges. Can you tell us something about, do you custom make that also? Because you may go to a place where there might not be enough of facilities that can probably fit the technology that you have compared to another part of the world.
Yeah, excellent question, thank you. We have one ESG and sustainability agenda that has environmental and social parts. Yeah. And therefore, so it's more when in the parts where we work with our customers and partners, of course, so the access to care, but also affordability or using digitalized care. So that's part of our social agenda and access to care parts that I was not deep diving on today. The environmental agenda, though, so are also strong and global because we believe that right now half of global population cannot access basic healthcare services, but the other half, we all together drive too much emissions and avoidable waste. Yeah. So therefore, our agenda is one, and it consists though of the several components though, so that it's a bit complicated. But then also, we do not have a separate ESG or sustainability strategy. It's a company strategy that includes all of this. And when we work with the regions, with our customers and partners, that's where we can dial up, for example, one element of this, which is most relevant for this customer in the region. For example, we are innovating, in fact, a point-of-care ultrasound Lumify, which brings accessibility, affordability of ultrasound. And we are right now in the R&D and innovation process of together with Bill and Melinda Gates Foundation support to innovate Lumify ultrasound for underserved areas and to be able to be used by not skilled sonographer, as an example. At the same time, it's a Lumify or ultrasound imaging, which is one of the most sustainable imaging technologies. So that's the other part of the coin. So in terms of imagine that everyone could have access to diagnostics, ultrasound technology has amazing possibilities for this to be more sustainable, of course, within the limitation of its possibilities. Because when we talk about MRI, so MRIs, that's where we're also strong on each of our technology innovation, the eco-design, where we design for energy efficiency, less materials, less resources used, then circularity to be able to reuse it, and also and the part that allows us to bring the diagnostics more closer to the patients, where we also have, not yet in Asia region, but we started in other parts of the world, MRI, which is mobile and on wheels, and also MRI that use much less natural resources like helium, which for those that know radiology, helium is limited resources, and it's one of the many resources that we use that will run out soon. So that gives an example. So this is how we use both environmental and social elements across our portfolio. And in some modalities, some technologies, they converge, and that's beautiful.
Thank you. So we have another 15 minutes. I got 3 questions, which is not related to ESG, but we will still go through them. So the first question is, I guess, is for Indonesia, because you're the only one from Indonesia on the panel. Question goes, how do you ensure equitable access to quality of healthcare for all population when it comes to sustainability in healthcare? Take Indonesia as the largest archipelagic. How do you answer that?
This question really is the story of our life for the past 2 decades. How can we bring quality care to the ends of Indonesia? And I think that quality care in different parts of Indonesia will look very differently because Indonesia is a heterogeneous country. So Indonesia is really like 20 different countries, different demographics, different ability to pay, disease, and sometimes also regulation, payer, and et cetera, et cetera. So the question is, how can we create a model that is right for that community and for that population? And that's why we have different kinds of models when it comes to hospitals for different cities. We have an MRCCC, Moderator Riady Comprehensive Cancer Center, in the middle of Jakarta. It is a center that has the highest or one of the highest levels of clinical capability in the country and gets referrals from all over the world. Now, that model will not work if you put it in a much smaller city. Now, in cities such as in Bhutan, which is an island population of 200,000 to 300,000, we have a much smaller operations, and it is mainly BPJS patients, which is patients from the government program. And so we have a much lower cost structure, a much smaller formulary, and a much more narrow services that we are providing in those hospitals. So I think the answer is that you really have to look at what the market is you serve, what the ability to pay is, what is the catchment size, and do a business modeling for that to make sure that you are able to provide quality care wherever it is you are. It will look different, but we have found that there are very many models so that we can go to different populations in different settings and achieve the same thing.
Thank you. The second question is something that I think you have already answered earlier. How do you get a C-suite to executive fund scaling environmental friendly solution when credible data is currently lacking? I think you did mention just now.
I'm going to add something a little bit more practical to this. Yeah, I was thinking about that question. And I think that chances are your colleagues or your CEO or your president director is not opposed to the what, but they're probably opposed to the how. In this day and age, there's enough awareness that climate is an issue. I don't think you will find any executive that will say, no, I don't want to help the planet. So it's not really the what, but it is the how. When you come into questions, so can we implement this technology? Can we spend money here and there? And therefore, that is where then the debate often happens. So I think that my advice would be start with solutions and technologies that are proven. There are a lot of technologies where the return is a lot longer. Those solutions may not be as attractive to start with. So don't start with a solar panel. The return is much longer. And I think that the world is trying to see how we can make this technology cheaper and make the funding cheaper as well. But if you start by saying, okay, at the end of the day, the outpatient manager is going to do the rounds to make sure that the AC is turned off and the lights are turned off and all the faucets are closed properly, I don't think anybody is going to be opposed to that. And then you can measure what your baseline is, and you can measure what your savings is, and then you have data, right? So start with the low-hanging fruit, technology or behaviors that are proven. So oftentimes it's not just technology. Oftentimes it is the behavior. So, I would suggest starting there, and then it is a journey, like I said. And as you have quicker wins, then it builds credibility and opens up doors for you to implement more sophisticated technology that may have a longer return on the investment. So that is what my advice would
Start
be.
with simple things, doable, which is logical, and you don't need to go right up there because you need to do simple things that you can do. Now, the last question, Andrew, is a sales talk for you. How our hospitals using accreditation, JCI 4th edition before COVID? If you want to go for the JCI, what is your suggestion to prepare for JCI accreditation? How many hours do you need for this? You can do it in 2 minutes.
Yeah, I'll give you the simple answer. So if you go out the door and you turn right and go to the end, and then turn right again at the end, and then right again, into the hall, come and speak with John and Nick and me, and we'll walk you through it. But more seriously, because this is not a sales pitch for JCI, two things. One is a lot of organizations are concerned about what you need to go through to get JCI accreditation, and that's understandable. We are trying to assure the public that your organization is at a level that they can trust, and that so it has to be at a certain level of challenge. However, it's still possible for most organizations. So if you're thinking about it, rather than worry, just come and talk to us or the many organizations in this room who've gone through the process. But the other thing I will say, because in a little bit in response to the previous question around how we adjust for around the world, we've just brought into the organization Dr. Neelam Dhingra, who you may know as until very recently, the former head of patient safety for the WHO. And part of that is we recognize that we don't work with every organization. Not every organization is at the level that they can reach a gold seal accreditation, is not there yet, but is moving along that pathway. And so we're looking at ways that we can work with organizations, public hospital systems, ministries of health, governments, smaller organizations in regions, to enable them to go along the journey of patient safety and quality and sustainability, but recognizing that they're not at the level that they could reach, for example, our type of accreditation or many of the other type of accreditations out there, but provide simpler standards that will recognize efforts and help guide their improvement journeys and bring their staff together. So that's something that we're working on as well, recognizing that there are differences around the world.
Thank you. So we don't have any more questions, and my time shows 3:29, though it says 8 minutes. By schedule, we're supposed to end it by 3:30. So let's do this. You give us one last message on the technology front, on ESG, and then you talk about accreditation, just one sentence, 2 sentences, and finally Caroline will tell us about hospital. Just in 1-2 sentences, message that you want the audience to go back with as a conclusion.
We believe that there's opportunity to partner, to collaborate, industry and healthcare, to decarbonize healthcare and to deliver great quality of care to more people. For this, when you're looking at the technology in your next round of choice, on your next element of usage of technology, think of its sustainability. What are the green qualifications? What are the green standards, requirements that will reduce this technology carbon footprint and make it future-proof? And make sure that you deploy it in your organization. Thank you.
Thank you. Andrew?
Let's go back to the quote. As many people were killed by pollution caused by healthcare as were killed by preventable medical errors. Sustainability is a patient safety issue.
Thank you. Caroline?
As hospital leaders, we're constantly having to respond to the different challenges and expectations And the world is continuing to change, and this is not the first time we're going to be adopting something new. And I think my message would be, try not to think about it as something that is on top of what you do, but try to think about it as we have to see things differently, and we have to change the way we do things and embed it into the day-to-day life of how we do things. It's just like digital. You can no longer see it as an additional. It is a part of the fabric of how you operate your hospital. And so when we look at sustainability, it should become also a part of the fabric of how you operate and manage your hospitals. Thank you.
Thank you. So with this, I think we come to the end of our panel, and I think you must agree with me that the last 1.5 hours, we learned a lot from these 3 esteemed speakers, and let's join together and thank them. You did fantastic. And hopefully, in the next 2 years or maybe 3 years, we meet up together and probably update. And a lot more will be different in the next couple of years, because I think we are just at the beginning stage as far as healthcare is concerned, in a very holistic way, the way we are doing it. I'm sure we have been doing this inevidently before on environmental friendliness in hospital, but we have never been recognized. I must say that we have never been recognized in a hospital. So I'm sure the future is going to be bright, and we will see things very differently in the next couple of years. With that, once again, thank you very much. You all been great, quiet audience, but it has been great. Thank you.